What I'm going to do is that I'm going to talk about two things. One, I'm going to talk about what the new education policy really, talks about in terms of a child's development in the areas of mental domain, cognitive domain, psychomotor, etc. And two, I will briefly mention about some of the important interventions that we have done in the COVID times. I'll begin with my first slide. Can you please take the next slide? So the new policy, which was announced on the 29th of July this year, actually, if you want to sum it up in one line, that line is holistic growth and development of each child is the central focus of the policy. So it is not a policy which is completely focused on cognitive development. It is a policy which actually takes care of the social, the emotional, the ethical, the physical, the spiritual development of the child. Next, please. In this policy, there are many shifts that have taken place. And I want to put this in perspective because this will be important for us to understand how in India we are in the coming few years going to integrate a lot of areas of child development into education. The first shift that has taken place is from a focus on only cognitive growth and development to a sum total of mental, physical, emotional, spiritual, and socio-cultural aspects of development of the child. The second thing is there used to be this unusual focus on rote learning and memorization, and the shift is towards learning to learn. From chalk and board, we are now getting into bringing in experiences into the classroom based on the child's real life experiences. We are going to bring in a lot of differential and a lot of innovative pedagogies into the classroom. The focus earlier was on content mastery, and now we are going towards competency. So it is the competencies which will be more important in a child's development and growth. And these competencies would not only be related to the cognitive areas, but also, as I have been mentioning, to the psychomotor domain, to the affective domain, to the life skills, to values, to ethics, etc. The earlier focus on completing textbooks, we have this, this habit in India where we focus only on the textbook and the syllabus. So here now the focus is shifting towards understanding what you're learning in class to what is happening in the real world. The earlier focus on board exams, we have these board exams at 10th and 12th standard level. And the focus, in fact, the entire education system for even a 3-year-old is geared towards preparing that child for the board exams which the child has to take at the age of 16 and 18 years old. That focus is now shifting to a complete focus on interrelationships between various areas of development of the child. And lastly, the teachers. The routine training that we used to do for teachers is now shifting towards empowering them to take up their own pedagogy on the basis of the unique requirements of every learner. So we would like to equip them, empower them to do this. Next slide, please. Now, this is the sum total of how the new education policy is going to integrate all these aspects. These exact words have been used in the new education policy. No hard separation. Now, no hard separation is not only no hard separation between subjects, between curricular and co-curricular, between sports and arts, between academics and vocational, but it is also no hard separation between affective, cognitive, and psychomotor domains, between life skills and values, between values and academics, between ethics and academics, etc. So this no hard separation is the cross-cutting theme across the whole new education policy. Next, please. Now, the policy has a whole child approach. We have a tendency in our country, in many countries, to divide the child into subjects. So the child, and we also have a policy of, we also have a system of dividing the child's body. So the head is supposed to be in the classroom, the body is supposed to be in the playground, and the child is actually, as far as the emotions are concerned, you're not supposed to speak about it. Whereas in this policy, we have this whole child approach where everything has to be addressed in an integrated fashion. So there is what this word holistic education occurs throughout the policy. The idea is that the child, once the child comes to school, It's not only the teachers who will get into the life of the child, look at the unique possibilities and potential of the child, but it is also the parents who have to be guided. It is also the peer who has to be guided. It is the school management. It is the community which has to participate. So this no hard separation for the purpose of holistic development begins with the statement that there will be no hard separation in subjects. Next, please. I have already mentioned that it is not just the cognitive domain. So this policy actually for the first time brings preschool, that is early childhood care and education, into the fore. And the early childhood care and education, you'll be surprised to know the national curricular framework that is being developed for this phase is for the period of 0 to 6 years. Now, people always ask us, what are you doing for a zero, which is just a newborn child? Actually, for the 0 to 3-year-old children, we are preparing a framework for the parents who, along with the Anganwadi workers and the preschool facilitators, would guide the parents into what can be done to ensure full growth of the child in terms of all the domains that I have been speaking about. And then 3 years to 18 years, of course, we are building a new national curricular framework, integrating all these aspects. There is a huge focus on character building and skills. The life skills that we talk about, which is, from creativity to collaboration, etc., to life awareness, to self-awareness, to empathy, to sensitivity, to inclusivity, all these things are going to be a part of the whole system of delivering and facilitating the child to be able to learn. And this is not going to be an easy task. We have just started the work on rebuilding the national curricular framework. We are doing a lot of consultations even for preparing the national education policy. We went through 5 years of consultation. We went down till the grassroots. In fact, 250,000 local bodies and the community members of 250,000 villages and cities were consulted for this. Even after the policy came out, how it should be implemented, we went back to consult our stakeholders, and we have got 1.5 million suggestions, each of which is being analyzed now, and several of them are now going to feed into our implementation plan of the policy. Next, please. Now, in this whole child approach, the curriculum is actually the linchpin. And what we realized is that the curriculum is so huge and so much focused on the cognitive area. That is why the policy recommends that the curriculum has to be really reduced. This is the first time that a policy is actually speaking it out and saying that the curriculum has to be reduced to the core essentials to make space for other things in the life of the child. So the child has to have the holistic aspect of development based on inquiry-based, discovery-based, discussion-based, analysis-based, experience-based, art-integrated, sport-integrated learning, etc. And the exams are to be made easier. For a policy to say that exams should be absolutely easy is something which is very, very courageous, we feel. And this policy says it out very, very clearly, that exams are not the focus of this policy. It is the child who is the focus of the policy, and the child's integrated growth is the focus of this policy. Therefore, the pedagogy is also that is being recommended, and we have started training our teachers already on this, is experiential learning, sport integrated, art integrated, and storytelling. And one absolutely new form of pedagogy which India is going to adopt for the whole nation, for all of our schools, it is called toy-based pedagogy, in which we are actually mapping the toys of India, the indigenous toys, mapping what kind of skills and competencies can be derived from those toys. And we are going to introduce them into classrooms from 3 years to 18 years, including board games, electronic games, puzzles, etc. The idea is to use these toys not only for a lot of collaboration work, but also for mathematical thinking, promotion of scientific temper, etc. Next, please. Now, in this approach, teachers, as I have already mentioned, would be the linchpin, and the teachers, the training becomes really very important. And we have already initiated training of our teachers through the online mode. Because of COVID, we were forced to go into the online mode, and we are so proud to say that it is actually, the teachers are actually lapping it up because they find it much easier to undergo training anytime, anywhere. One of the very, very important aspects of this policy is the holistic progress card. Can you imagine an entire country of 250 million children who will actually have a holistic progress card, which would be given to them every 6 months? This progress card will reflect their progress, yes, in the cognitive area, but also in the affective domains, in the psychomotor domain, in the life skills, what kind of values the child has, what aptitude the child has, what is the unique potential of the child. And this holistic progress card would be based on artificial intelligence. When the child leaves the school at 18 years, this progress card will be available in the digital locker of the child, and anybody, any employer can actually see all the unique potentials of the child that the child has developed. And cognitive domain is not going to be the focus of this. This is based on self-assessment, peer assessment, teacher assessment, parent assessment. Next, please. Now, coming to the COVID challenge, India is a very, very huge country. And in fact, this country is equal to several countries put together in terms of population. The child population itself, the student population of India itself, is close to the entire population of America, of USA. So you can imagine what we are talking about. So 248 million students are there in this country in the school age going group, and I'm talking about 6 to 18. I have not included the 0 to 6 here. There are 1.5 million schools in this country and almost 10.5 million teachers. So when we look at this wide scale, and this is a place where we teach in more than 40 to 50 languages, the medium of instruction that I'm talking about is more than 40 to 50 as of today. We have 1,642 dialects in this country. So even though the medium of instruction may be 40 to 50, the dialects are several even in the classroom. We have remote areas, we have tribal areas, we have hills, we have mountains, we have rivers. So the diversity and the challenge and the geography and the logistics, everything is huge for us. Therefore, the concerns obviously are also very huge in this COVID times. We are very concerned about the mental and physical health of the children. There has been a huge learning loss. There is instruction loss and a huge learning loss. We cannot expect the child to be able to cope very easily with the learning now. And there has been some amount of burnout of teachers as well as parents because the sudden oncoming of the online learning process and teaching process. It was something which our teachers were not prepared for, our parents were not prepared for. And in the process, there has been some amount of burning there as well. Online learning, we have a lot of issues. We have issues of access and connectivity and teacher capacity, etc. And as I mentioned, languages. So we went around with a lot of interventions, and of course, we initiated the interventions with cognitive interventions. But in the cognitive interventions, we ensured that the mental health of the child is taken care of. A very interesting intervention that we have done is called the alternative academic calendar. So you just put your textbooks aside. Our National Council of Educational Research and Training came out with this calendar wherein the skills and the competencies are taught with the processes and with experiences that the child has at home. I'm giving you a very simple example. A class 3 child, for example, has to learn has to be initiated into history. The child is asked, why don't you make a family tree, a history tree of your family and submit it online or through physical submission. So simple things like that was introduced, and this alternative academic calendar has really caught the imagination of the nation. This has been translated in all the languages of India, and it is being implemented as such everywhere, where textbooks is not the focus, but the focus is how to engage the child in a joyful, engaging manner. Similarly, a lot of other interventions are there. I would not like to go through them for want of time. I would just like to mention one more, which is our energized textbooks. So to ensure that every child gets anytime, anywhere access, all our textbooks have been energized. What do I mean by that is that each textbook in every topic and in every hard spot, there is a QR code. And in that QR code, behind that, there is extra explanation in terms of animation, puzzles, videos, audios, etc. And these QR codes can be simply scanned with a barcode reader on a normal phone or any other simple barcode reader. And then the entire material is available offline. And this has been put on our national digital infrastructure. And we have received more than 800 scans of the QR, 800 million scans of the QR code in the last 4 months alone. What I'm trying to show is that children's, the gift to be able to learn, that gift is not lost. Children are curious. Children want more material. They want new stuff. And this is one way that we have been able to give to them. The silver lining in this whole COVID situation has been something very, very interesting. I will just show you some photographs where very innovative fashion of reaching out to the children has been achieved for taking care of not only their cognitive abilities, but connecting with the children so that some kind of support for their mental anxieties and concerns can be given. And this reaching out has happened through schools on mobiles. It has happened through schools on bullock carts, schools through public address systems inside villages, through youth volunteers, through alumni, through mothers association, PTA, the local bodies, civil society, social media, IVRS. There are IVRS in almost every state, integrated voice response system, where the child can simply call a toll-free number and ask a lot of queries on any subject. Then peer groups, etc. So there has been also a lot of innovation in the process in this COVID challenging time. Next, please. So here I just wanted to show you this photograph. This is of a very remote area called Dhunka in Jharkhand, where this teacher who you can see standing right in the right at the end near the chair in the left photograph has actually innovated by making these blackboards behind the houses. And this is a COVID time school which is going on. Next, please. These are some of the other schools we are having. So all open spaces, children go there, the teachers go there. Teachers are very, very dedicated. We also have teachers who teach through mobile phones from their homes. So we do not have access necessarily with all the teachers. So they are using whatever resources they have available to them for this purpose. Next, please. So the teachers and the students have both got together, and therefore both of their mental health becomes very important issue for us. It's a huge population. 1/5 of entire India's population consists of school-going students and teachers. And therefore, we are talking about 20% of the population's mental health here. It becomes really important. In this period, therefore, we came out, we realized, what I put before you in the slide is all the kind of concerns, anxieties, vulnerabilities that children are facing. We have even come across increased, negative behavior by parents. Sometimes there is violence in the house. All kinds of issues are happening. And where there was no mental health concern, it is coming up in families, and families are not understanding what to do. In my own office, I find, my own staff, I find that there is a change in behavior, there is irritability, there is anxiety. It is happening to all of us. With this background, can we go to the next slide? With this background, we decided in the ministry to come out with a toll-free helpline, which is called Mandarpan. This ministry has experimented with toll-free helplines for telecounseling for the last 24 years. So the Central Board of Secondary Education, which was my previous stint, there every time we have a board exam, we open the toll-free telecounseling helpline, and thousands of children, parents, siblings, teachers, peer group, they call up. And we have actually managed in several cases to even avoid suicides, because we have to talk through with the children. We have got in touch with the parents. So we realize that it is a very important aspect now, and therefore this Mandarpan initiative, which was launched in the month of June, has been started. Aside from this, the Mandarpan initiative also has several other parts to it. Firstly, we are doing a lot of webinars with parents, with teachers, with students. We have actually collected a lot of audiovisual resources and videos and posters, etc., which we are sharing through our website. We are now coming on with out with online chat room. We are also developing a national directory of counselors. And this directory would then be made available to the stakeholders so that it can be used. We are also looking at issuing a lot of advisories. So we are coming out with training modules for parents. We are coming out with training modules for teachers. We portal called Nishtha on which we upload all these training modules. So we are trying to integrate all this into the process of the cognitive and overall development of the child. The entire aspect of mental health is being integrated in our national curriculum framework as a very important aspect of the whole growth and learning process of the child. So the NCF for the first time is actually going to integrate this process from 0 years to 18 years for every child. And this NCF is going to be ready and finalized by August 2021, and that is going to initiate a flurry of reforms. Next, please. So this is my last slide, and as you can see, I have summed it up as schools and teachers, they are really important for our children because it is their capacity which becomes the strength of our learner. So, and as you can see here, joyful education is the key, and holistic education is the key for good mental health for our teachers as well as for our students. Thank you very much.
Thank you, ma'am, for a very interesting presentation on the new education policy, the importance of holistic development of the child, and how mental health has become an integral part of the national curriculum frame.